Hello and welcome to this episode of DMC's Medical Matters. Today we are talking about back pain with orthopedic surgeon Dr. Scott McCarty from DMC Huron Valley-Sinai Hospital. Welcome, Dr. McCarty.
Thank you. It's a pleasure to be here.
Let's talk about how common back pain is.
So back pain is extremely common in the general population. And in fact, it's one of the most common reasons patients will go to the emergency department or visit their primary care doctor for evaluation. And this includes all things like acute low back pain that may develop after participating in unaccustomed activity or doing some heavy lifting, pushing, and pulling, to chronic low back pain that can develop over time as we age and degenerative changes occur throughout the spine.
Because back pain is so common, how do we know when it's something that we can treat at home, and when should we see a doctor?
So fortunately for acute low back pain, many of the times the symptoms will resolve on their own with time, and we're able to recommend conservative treatment with things like activity modification, over-the-counter anti-inflammatories and Tylenol, and hot and cold compresses. In the event that they don't resolve, or in the event that when they present, the symptoms are so severe that the patient doesn't have good function, can't do much, we would recommend coming in sooner at that time for evaluation. There are a few instances where urgent evaluation and management is indicated. And that's when there is concern for infection, tumor, or severe stenosis leading to cauda-equina syndrome. And some of those symptoms may include unrelenting pain that's so severe the patient can't do anything even at rest, numbness, unexplained weight loss, fevers, chills, night sweats. In the event of severe stenosis and cauda-equina, loss of bowel and bladder function, or paralysis.
Tell me a little bit about the team that takes care of spine patients here at the DMC.
So here at the Detroit Medical Center, we function with a multidisciplinary team. So what that means is we have providers from different specialties that work together to help take care of the patients with spine-related conditions. So people like myself who are spine surgeons, our physical therapists, we have non-operative specialists who specialize in back pain, as well as our pain management physicians.
And surgery is not always your first choice, is it?
It is not. So we try to treat the patients conservatively for as long as we can, for as long as we're able to treat the symptoms and maintain their quality of life and their function. So we always start with things like therapy, medications. Our non-operative spine partners can do manipulations and adjustments in the clinic. Our pain management colleagues can do injections and some regenerative medications. And then when patients having more bad days than good days, and the conservative things that we've recommended just aren't working for them, then surgery may be indicated.
What are some of the conditions and procedures that the DMC specializes in?
So our team specializes in treating all types of spine pathology, includes acute and chronic low back pain, herniated discs, instability and deformity, lumbar stenosis or pressure on the nerves, infections, and tumors.
Great. Well, thank you for all of that information today. And if you would like to make an appointment with a DMC orthopedic surgeon, please call 1-888-DMC-2500. And for more information on our spine services, you can visit dmc.org/spine.